Welcome to another episode of the HealthCast. I'm your host, Phil Zappone. I'm really excited today to have Heather Campbell on. She is the CEO and founder of Ready, Set, Recover, a tool to help really with surgical patients and help their journey through surgery, which can be really scary. We're really excited to have you. Welcome, Heather.
Thank you so much. I'm excited to be here.
I'm wondering if you're a writer by trade and maybe a consultant?
What am I by trade? That is such a good question. I have had a lot of interesting jobs. I've had a lot of weird titles. I've been the synergist. I've been an alchemist. I'm a writer. I'm a founder. I'm a CEO. The throughput in all of these things is I'm here to help people feel seen, heard, and celebrated. That is what I do in all of the things that I do. That's the through line. So yes, I do write. I have a book. I write all the time. But the Ready, Set, Recover truly was a living embodiment of making people feel seen, heard, and celebrated, giving them action.
I love it. I love it. I was telling my wife just this morning, as I've been having these conversations and exploring this topic of healthcare and AI integration, one thing that's been really reassuring is I've been talking to really talented and interesting people, and these tools are great and they're amazing, but it's about people. Hearing that, it's about better relationships, better outcomes, people. It's not about something taking your job.
No. Right. Completely. It's funny. Again, when I talk about my book, it's not about, so the book has stories about me. Ready, Set, Recover has stories in it from other people as well as it really came from my experience. But it's not about any of those things. It's about you. It's about you and your story, and how are you telling your stories, and how are you looking at yourself in those instances. So Ready, Set, Recover is a beautiful platform. It is enveloping. It is easy to use. We have used tools to make it beautiful, to make it engaging, but ultimately it's about the patient taking actions and looking at things from themselves. It's interesting, and I would be so fascinated with all of the conversations that you're having. You know, it's integration. That's what we hear all the time. We've integrated the patient right out of the entire experience.
I work in rural medicine and here in Southwest Colorado, and unfortunately, our hospital has high turnover. And what I'm finding as I've been getting busier, because we have a lack of staff, just that the word trust keeps coming to mind, and rapport. A new patient will come in and be like, "Are you going anywhere? Are you leaving?" And they're thirsty for human connection.
Well, and it's interesting because Ready, Set, Recover is an online platform. So it is from a business perspective, that's wonderful. It's scalable, completely scalable. It's also, I don't have to worry about inconsistency because I know it's going to be consistent, you know, to the patient saying, you know, you're new or you're here or you're staying. However, it is very emotionally intelligent in terms of how people respond to it. And while it's all online, we recognize the importance of human connection. And so that's why we created your surgery supporters. But they're people within your own life. So we're, number one, validating it's okay to ask for help. Number two, we're curating that back and forth. Again, making people feel like, oh, I can ask for help. Oh, I need to actually think about how I'm going to ask for help. Mm-hmm. You know, within surgery, one of the things we talk about a lot is surgery and recover takes time and attention. You can either give it the time and attention it needs, or it will take more.
Mm-hmm. Having had surgery, I understand.
And it's fascinating. I love talking with people who are in healthcare, and when they say, you know, having had surgery, I'll raise my hand. It is hard to live into the things that you know you should be doing. We had one nurse go through Ready, Set, Recover. And at the end, she offered to give me some feedback. And I said, you know, fabulous. Tell me a little bit about yourself. And she said, well, I'm a nurse. And I thought in my head, oh God, you're a nurse. I'm really uncomfortable.
Yeah.
And I said, so did you know everything in the platform? She said, oh yeah, I knew it all. I knew everything. I said, well, okay, how'd we do? And she said, excellent. No jargon. Written at the right level, all the right elements. It was fabulous. It was excellent. But then I said, so do you want your money back? Did I waste your time? And she said, oh, no. I knew everything. I wouldn't have done any of it without the framework. You know, at this point, most people know, you know, things like, I should pay attention to what the doctor says. I should actually give recovery the time they tell me, but without the reinforcement. One of the things she loved, we have a sleep tracker, where you again are putting in
Yeah.
the information. She said, I've always known I didn't sleep enough. I sleep 4 hours a night. Until you had me track it, I just kind of thought, oh, I'm not sleeping enough.
Yeah.
So those are the things that are happening and that we're seeing.
That's fantastic. What exactly is Ready, Set, Recover?
So it's an online platform. You can use it no matter whether you want to use it on your phone, your computer, your tablet. It's pre and post surgery, and there are action steps around no matter what kind of surgery you're having. So it's not you're having knee surgery. Here's what you need to do for your knee. That's what
Mhm.
your doctor tells you. Your doctor knows you, your medical, everything that's going on with you medically. They are honed in on that. Ready, Set, Recover is looking at, okay, this is a process you're going to go through. The medical team knows the medical side. Unfortunately, the medical team is too stretched to pay attention to anything else. Like you were just talking about where you were probably doing 5 different jobs at this point. The average patient has 13 minutes with a doctor. That is
Yeah.
not 13 minutes.
Mm.
Time to get through the medical crazy stuff, let alone how are you feeling? How are you going to get help? What are you going to do? How are you going to take care of yourself? So that's where Ready, Set, Recover comes in. We are the perfect complement to the wonderful help and attention you are getting from your medical staff. And in going through the platform, again, it's 16 days before surgery, 8 days day of and after. So it's before and after. It's not, again, one of the things I like to say is surgery starts the minute you hear the words you need surgery. From that second on, you are going to be making decisions that are going to help you or hurt you in terms of outcomes. We raise our hand and say, so come on, we're going to help you. We're going to help you look at this process. We're going to break some things down, things that you otherwise just wouldn't have thought of. I had one administrator looking at the platform and they looked at everything and they're like, okay, can you go back to surgery day game plan? And I said, sure. And so I walked through the game plan, and it's basically, if you were going to go on vacation, you'd think about, what am I going to do? What am I going to pack? What do I need to bring? How am I going to get there? Will there be traffic on my way to the airport? Do I need a passport? You have surgery and you think, don't eat or drink after midnight. That's it. So this administrator looked at it and said, I believe all of it. I believe mind-body connection. I believe in engagement and stress reduction. I believe in healthy habits. I believe in all of it. If the only thing Ready, Set, Recover does is get people to my OR on time, that's enough. Because for them, that was their pain point. And again, that's one of the beauties of this from a business side is what we're doing absolutely benefits the patient. They're the users, but really it benefits the hospital, the surgeon, the insurance company, the employer, and the caregivers. It helps everyone because a more engaged, less stressed patient benefits everyone.
Sure. And Ready, Set, Recover, you developed it, and it stems from your own personal experience
Yes.
with surgery.
Yeah. I was having surgery and got nervous
Yeah,
and
of
went and
course.
looked for what can I do? Yeah. It's funny. There's a statistic out there, 92% of all of surgery patients have preoperative nervousness and stress, anxiousness and stress. I want to know who the other 8% are.
My first thought, I would assume it's people who are either have a long-term medical history, long-term illness, or
Right.
recurrent surgeries and have been down that path where
Right.
they're not
Right.
really phased,
Right.
unfortunately.
Right. But I was one of them who was nervous. And so I looked for what can I do? Like I believe in structure. I am a potter. I make pottery. To do that, I took a class.
Sure.
I wanted someone to instruct me. So I looked during this time of feeling nervous for someone to instruct me. What could I do? And I could find PT and pain meds. And I was like, no, I haven't had surgery. I don't need PT yet. And I'm not looking for medication, although I understand, medication can be beneficial. I want to do things.
Yeah.
So I have a wellness background and I looked at what could I borrow from other things that I've done. And I talked with some other medical professionals and and other wellness people, and I pulled together my own little program. And afterwards, my surgeon was admiring his work. He was very happy with everything. No PT, no pain
With
meds.
your outcome.
He was very thrilled with the outcomes.
That's great. That's great.
And he also recognized I had played a role in it. And he said, I wish all of my patients could be like you. And I thought, okay, I'll go do that. I'll start a company. How hard can that be?
And here you are.
And here we
and
are.
that 2022?
So yes, so I created what I called was the crayon version of the MVP. And then another serial entrepreneur looked at what I had done and said, this needs to be an online platform. This needs to be enveloping. This needs to be behavioral therapy, CBT. It needs the there to really make this into a company. And so we took some time and really honed in on what it could be, listened to patients a lot, listened to medical professionals a lot. We are constantly adding, we just added a medication tracker into the platform. Medication non-adherence is a huge issue. So this is one of the things that we're doing. So we just keep adding to it. And our goal at the moment is to be doing studies with hospitals.
Yeah.
Everyone nods their head that yes, this whole thing makes sense. But to actually get it ingrained into the systems, you need the data. And so that's what we're actively pursuing right now.
That was my next question. Do you have anything to share about improved outcomes or something tangible we can get our heads around?
So anecdotally, what we are seeing are all the things that you would want to see. So more engaged patients means shorter hospital stays, fewer readmits. One of the most interesting things, again, I came at it from a patient perspective. We're seeing less burden on staff. And I have another personal experience with that. My child had to have surgery. She's absolutely fine, but she had to have surgery.
Great.
And we're in the pre-op and they're buzzing around and they were 2 hours late for the surgery. There's normal. Says, yeah, it is. It's totally like a hive. And one of the nurses stops and looks at me and says, so Mom, I got to tell you, you've been amazing. And I said, thank you. And she said, your child too. And my kid's sitting there doing breath work, looking away, doing breath work while getting the IV put in. And I said, well, I have a company that helps people get ready for and recover from surgery. And all of them stopped and turned. And you could see the weight I had lifted from their shoulders. Here's a caregiver who is not saying like, why aren't we on time? What did you do? I've brought my own food. I'm taking care of my physical needs as well as my emotional needs. I've taken care of my child's emotional needs because I know not to give her anything to eat after midnight. But I'm working in tandem. I'm working in partnership. Again, there are so many different elements. The beauty of this is it benefits all of the different constituents.
I love it. I've never heard anything like this. Tell me about some success stories and maybe some challenges that the company has overcome. Things you're really proud of and things that have been more difficult.
I mean, the success stories are hearing from people who have gone through it.
Yeah.
And it's just the first time I got an email from someone, I was so nervous. I was like, I don't want to open this. And it was from someone who actually had surgery before. And they said, look, I had surgery. I went into this thinking, I know how this is. I know how this goes. This was a completely different experience. I had a response from another, we have a lot of nurses actually who use it. A trauma nurse who said, he told me that, his surgeon was so proud of himself. His surgeon was like, I've never seen anyone recover. Like, I must have done such a great job.
Okay.
And the nurse was like, no, it wasn't you.
Yeah, right. It
was Ready, Set, Recover.
Yeah.
Which is kind of fun. I've also heard from people, again, we've heard success moments from people that have then led to more success. One of the people who had gone through it talked about how sad they were when it was over. They've got a supportive family, but really their family was done the day of surgery. They were at home. They're not visibly.
You made it.
Right. You're done. Like surgery's over.
Yeah.
But not with Ready, Set, Recover. We're still saying hi. Like there's still stuff to do here. But then they said when it was over, they were sad. Like I liked having you in my inbox every day saying like, you got this. And so from that, we created Healthy Habits, which is an extension of the platform, because we all could use positive reinforcement and reminders to be living the way that it's beneficial to us.
Yeah.
Some of the challenges are the challenges are big, I have to say. Again, back to that moment of, oh, okay, I'll go start a company. How hard can that be?
Yeah.
It can be really, really hard.
As a small business owner, I'm familiar with some of them, but yeah.
Yeah, you know, within healthcare, think about, while everyone nods their head that this makes total sense, getting the time and attention of hospital administrators, because ultimately I want to be ingrained in the system. My ultimate hope is that if you hear the words you need surgery, which unfortunately happens, there are 50 million surgeries in the planned surgeries in the US alone every year. And it's growing with the silver tsunami. Surgery is not going away. So if someone hears that they need to have surgery, I hope they hear two things right after that. Number one, the surgeon says, I'm really good at this. I've got you.
Yeah.
That happens. Number two, my hope is that the surgeon says, you are really important in this as well. You are going to play a role. You're going to do Ready, Set, Recover. We've seen the benefits from this. You are going to participate in this, and you are going to make a difference.
I love it. I love it. In the clinic room on my end, I definitely feel a shift. I've been in medicine about 20 years, and I feel a shift where I'm trying to empower patients, and especially with people's frustration, either with health insurance or medications. And I even really lightly walk on that political line. I'm like, I'm not sure wherever you stand, we can all agree that health insurance, to be honest, I don't feel like it's looking out for us, and that we need to look out for ourselves. So I'm trying to empower patients, and it sounds like that concept is critical to what you're saying in surgery as well. You need to, they're part of the, they're not a neutral component. They're an active, engaged participant.
It's interesting. I mean, just the word patient. I mean, it implies I'm being patient. I'm sitting back. I am here. We call them participants because again, you are participating. Whether you are actively engaging and positively engaging and doing what your doctor says, or like doing it or not doing it, that is the type of engagement.
I think, yeah, it's resonating with the things that I say, because I'll say to people, I use cholesterol as a somewhat neutral topic, and I'll say, well, this medication helps, but you still need to do your part. But the surgery helps, but you still need to be engaged. To maximize the benefit of it, you need to be engaged.
Everything, as human beings, everything we put in our head, in our mouths, in our hearts, on our skins, affects us. All of it. It's interesting. One of the things we do at Ready, Set, Recover, we talk about the story of your surgery, how you're gonna talk about it. Are you talking about it in a way that is true, but also benefits you? Are you creating cortisol or dopamine every time you tell the story? You want to create dopamine. You don't want to scare yourself every time you're saying it. My mother wanted, when I was having surgery, again, my story, I told it in a way, I said, I have good news and great news. I went to see a surgeon for something. The good news is that's going to be fine. The great news is he found something really wrong, but he can fix it with surgery. And my mom said, so that's great. What is it called though? And I said, oh, it's a conundrum. They don't know why it happens. She said, well, no, but what is it called? And I said, a conundrum. That's what I'm calling it. She said, no, I want to know the name of it. And I said, no, you want to help me because you love me. You're finding the name of it, searching it up, either worrying and sharing your worry or worrying and holding it on your own doesn't help me. You want to help me. You can think good thoughts as I work through my conundrum. I get to own it. I don't have to tell the name of my thing to anybody.
I have a buddy whose daughter was just diagnosed with dyslexia, and he sent us a message that he was proud of himself and his wife, that the way and I think this is what you're saying, the way they framed it to her. Once they had the diagnosis, this can be positive or negative. You're just learning in a different way. It's not good or bad. It's just, this is how you're going to learn information, and the idea of framing something. So I thought that, I hear what you're saying. That's great.
Yeah, again, and it does two things. Number one, we hear it over and over again. Like the story, what the words that come out of your mouth, you are hearing. It is creating a response in your own body. And then to what you just said, it frames responses. So when I said good news, great news to people, and I had to tell people over and over, they smiled just like you did and said like, "Oh, so that's good." I could have said, I have a bone eating lesion. A third of the bone is gone. It could shatter at any second and it might be cancer. That was the truth too. Number one, I don't want to hear it. Number two, I don't want to know that you know someone who had something that was similar and they died and that's horrible and cancer. Oh my God. I don't want that back from you.
That's great. I really like what you're saying. And it seems also like an approach to life of how, is that okay to say? Yeah.
No, it's totally okay. My sister, who loves me, called me to tell
Awesome.
me that she was having surgery and she was not going to do Ready, Set, Recover. And I said, okay, sure. Why not? Like, I'll give you the family friends discount. Like what? And she said, you can't fool me. It's not just about surgery. It's about how I'm supposed to live my life, isn't it? And I just said, it is. It really is. And she said, yeah, you're not going to get me. And I said, here's the thing. While it is about how it would be beneficial to live your life during this moment of stress and change, during this moment when it feels like nothing is in your control, just do it then. And if you want to do more later, awesome. But right now, your body is going to go through trauma.
It's a lot.
Why not set it up?
Yeah. How does the future look for Ready, Set, Recover?
So I do a lot of finger crossing and I want to be a part of the healthcare revolution. I want to be a part of moving us from, we don't, I hate to break this to everyone. We actually don't have healthcare in the United States.
Say it.
We have hurt care.
Hurt care?
Hurt.
I thought you were going to say disease management. Yeah. Something like that.
Yeah. We have hurt care. That is what we do here. That is, we have brick and mortars that are completely set up to help you when you are bad, not set you up to succeed.
Peter Attia in his book Outlive says his goal is that we're on the cusp of, is it healthcare 2.0? I don't think it's 3.0. I think it's 2.0. The idea that we're moving from reactionary to proactive.
Yes.
Is amazing.
Yes. Which is also really difficult to build models around. I get it as an entrepreneur. Back to this is how you should live your life. It is. And one of the reasons though that we focused on surgery is not only is it my story, it's got two very good motivators, fear and urgency. So there's a date. You're having something specific. That is something that we can work around. And you are nervous. And that creates a good momentum and a good motivator to do something. I want to be a part of the motivator. Like you talk about, doing that dance of giving patients agency and giving them action. We have to get to that. And again, I loved the way you said, these aren't political things. These are human things.
Yeah.
I want back to seen, heard, and celebrated. I believe with every bone in my body, which includes the one that almost shattered, if everyone had foundational needs covered and felt seen, heard, and celebrated, the world is a completely different place. We want to be a part of that.
And that, I love it. I agree with you. And that is, that's the future of Ready, Set, Recover. Be part of that transition and that kind of a paradigm shift. How about from a business perspective? How does the future look? I'd imagine promising.
Yes, very. And still hard, to be honest. So I am actively looking for partners. We have a randomized control IRB study that we've just signed off with one of the largest hospitals in Israel to do. That is for people who know about the study of the, empirical data world. That is the holy grail. That takes time, that takes energy, that takes money, that takes champions. But I'm very hopeful to see what that can be. We're also talking with people all over. I go to a lot of conferences and I talk with people, and it's, I've got this platform that's ready to go. I need partners. I am open to any hospital, surgery center who wants to come and say, let's test. Tell me your pain point. Let's look at it. Let's test it.
Is your current customer demographic individual patients who hear about you and reach out, but the goal maybe being the university or the hospital systems? Is that the...
Correct. Ultimately, I think this should be paid for by insurance because, again, when we are helping patients, we are helping the bottom lines of everyone. Fewer readmits, shorter hospital stays, fewer complications, higher HCAP scores, less burden on staff, turnover. Like, we are the bottom lines that are being affected by what we are doing. It also affects financially the patients, absolutely. Really, the people who should be, the organizations that should be paying for this, are insurance and the systems.
Yeah. You know what I'm hearing, Heather? That I'm hearing a lot of passion, and I feel like, having just met you and learning a little bit about you, it sounds like this business developed, but is truly not just a unique opportunity and potentially lucrative opportunity, but it's a part of your story, or part of, it's like, I sense like it's connected to who you are and how you
Correct.
treat people in your daily life, just
Correct.
on maybe a larger scale or more accessible scale for others, which is awesome. It's
Yeah.
a sense of genuineness about this. You're not just trying to sell T-shirts.
Which I like. I like t-shirts.
Yeah,
Actually,
yeah.
Life is Good t-shirts. Do you know Life is Good?
Oh, yeah, yeah.
Okay. My favorite t-shirt. I probably am wearing one of their t-shirts
Sure.
under the sweater. But yes, it is. In some ways, it's not selling. It's offering. It's inviting, which is hard. Again, from a systems standpoint, I had one person within healthcare, like knowledgeable healthcare, say that it was a bad idea. He actually said it was a terrible idea
Wow.
and it will never actually happen. And I was just like, okay, why? And he said, yeah, it's too logical and it makes too much sense. The healthcare, and he was basically talking about healthcare the way it is today. There are too many hoops, there are too many things. It's not about actual patient engagement. The hairball of healthcare, which has become
Yes.
too much of a hairball.
Yes.
That is, uh, no, that is something that most people can't work through. The beauty of what we're doing, and this is not my idea, this is actually Gordon McKinsey orbiting the giant hairball. That's what I'm doing. I'm orbiting it. I recognize what healthcare needs. I recognize what the patients need. I recognize what the systems are up against. And I'm not getting in there, and I'm not trying to fix the actual system. I'm just orbiting and saying, okay, you guys do what you got to do. We, however, are going to help the patient from this perspective. And in doing that, are going to help the rest of you as well.
That's awesome. I love it. I'm a nurse practitioner, and I like to tell that I'm still a nurse at heart, even though I function in a clinical role as a clinician, and that I'm a patient advocate at the
Yes.
core. I
Yes.
root for my patients. I want them to thrive.
Yes.
And that's what I'm hearing from you.
Well, and it's funny, again, thinking about the different touch points I've had. That same surgeon, I knew I wanted him to be my surgeon because before he met with me, he went into another exam room, and before he shut the door, I heard him say, "I have great news. You don't need surgery."
Yeah.
And to hear that from a surgeon,
Yeah.
and with joy and with oomph. I mean, he was really, it was also, so I was like, yes, this is the guy. And then it was very funny because I looked at there was a x-ray of my hands, and I looked and I was like, oh yeah, there is something really wrong. And then I was like, wait, that's the wrong hand. And, I was just kind of sat there like, I don't know how to read an x-ray, but I think there's something really messed up here based
Yeah.
on one of these things are not like the other. And I was right.
That's cool. That's great. Well, thank you so much for spending some time with me today, Heather. I really enjoyed our conversation. I really enjoy what you're doing.
Thank
And
you.
I'm excited to see the future of Ready, Set, Recover.
Thank you. I really appreciate it. And I love that you're having conversation. You're with curiosity. That's what drew me to talking with you. You are curious and hopeful, and that made it a fun conversation to have.
Yeah, thanks. There's a lot going on in our world these days, a lot going on with technology, and I wanted to involve myself and to learn. So
That's
thank you.
great. Yeah.
Thanks so much. Where can participants, where can
Yeah.
people learn more about Ready, Set, Recover at your website?
ReadySetRecover.com. We are there. You can ask us a question. If you are having surgery, you can start a trial for free. If you are an administrator who is interested in doing a pilot, you can reach out to us. We are actively pursuing those. And again, the goal is, from a business perspective, this is a company. Absolutely. It's a company where the heart and head are in the right place.
I get that. That's what from the get-go, I sense that. So good for you. Best of luck to Ready, Set, Recover. And thank you, Heather.
Thank you.
Thanks for joining us for another episode of the HealthCast. Stay tuned for more. Appreciate it, guys.